So today I'm happy to introduce Judy O'Keefe. She is currently the Vice President of Clinical Services and has the executive responsibility for a number of programs, including, among others, population and public health, long-term care, community supports, primary health care, rehabilitation, palliative care and geriatrics, infection prevention and control and research, and knowledge transfer. Judy is a registered social worker by profession and holds a Master's of Social Work from Memorial University of Newfoundland and Labrador. She holds the professional designation of Certified Health Executive, CHE, is a member of the Canadian College of Health Leaders, and is currently past president for the CCHL NL chapter. She is currently NL board member with the Canadian Home Care Association and is also a member at large representing rural Eastern with the Newfoundland and Labrador Public Health Association. So it is with great pleasure that I turn today's education session over to Judy.
Good afternoon. Thank you, Peggy, and thank you to everybody. So today I'm asked to present on the Newfoundland and Labrador Public Health Association and our vision for public health. And hopefully this will be of value to folks to learn a little bit more about NLPHA. We've certainly been around for a long time, but still have a fairly modest membership. So just to start the session, I guess I thought it's good to kind of set the tone for, what we refer to as public health and our definition of public health. So for our purposes, we use a definition of from PHAC, from Public Health Agency of Canada, that says public health is the organized effort of society to keep people healthy and prevent injury, illness, and premature death. It's a combination of programs, services, and policies that protect and promote the health of all Canadians. So that's the premise of which we are working from when we talk about public health. So NLPHA is actually has been around for quite some time, for certainly over 50 years now, I should say. Over 40 years, almost 50 years. We are an independent voluntary nonprofit provincial advocacy group, and we're comprised of a great variety of health professionals and community members and organizations who promote and support public health. So we actually have a lot of, I would think a lot of membership of the college are also members of NLPHA, and we're quite happy to have individuals who share common purpose with us in the Public Health Association. We're also affiliated with the CPHA, Canadian Public Health Association, and we're a member of the Canadian Network of Public Health Associations. So we have connections with other partner organizations across the country. We do meet virtually, and I assume most everybody is meeting virtually these days because of pandemic. And so we meet virtually on a bi-monthly basis and every second month. And on the other months, our executive team meets. And so we try to devote part of our time to an education or advocacy session and just really learning about what more we can do to kind of improve and expand public health capacity within the province. Like a lot of organizations, certainly, the pandemic did interrupt some of our normal business, and much of our membership focus has been diverted to COVID response. So, we're hoping that's, certainly with seeing some changes now across the country and the world with the pandemic, that we will start to get back to other business outside of pandemic response for many of our members. So just to review our membership, as I mentioned, it's a diverse array of people working in health and community services, but also educators and researchers and community members who are interested in health and social issues that affect their community. So we have a very broad range of membership. It's not just healthcare workers that are members of the Public Health Association. And I think that actually adds to our, the diversity and the topics and inclusivity of our particular organization. We're open to any individual who subscribes to our objectives and who are engaged in community or public health activities. So I really want to just learn about, how they can impact public health or impact the health of their own community. There's two types of membership: direct membership, which the majority of our members do have. And just to put in a shameless plug for that, if you're not a member of NLPHA and you're interested, we'd certainly love to hear from you. And we would welcome you, reaching out to one of our executive members for more conversation on that. It's a $30 membership, so really there's no reason not to be a member. We also do offer conjoint membership with CPHA, and we do have some members which do carry that. The benefits really of being a member of NLPHA are broad. You do have access to the support and expertise of our membership. And, our membership have literally hundreds and hundreds of years of public health experience. We have quite a variety of individuals who've been core public health their entire lives, who specialize in that field, to others who are, general community members who have an interest or work in, an affiliate organization that are interested in public health. As mentioned, we do offer education sessions, which, over the last couple of years have been a little bit slower, but certainly we've had quite a variety of education sessions that we offer, always trying to, focus on how we can improve public health capacity and really look at some of the, evidence-informed practice around population and public health. We do have regular business meetings as well. Our goal mostly is the advocacy work for evidence-informed healthy public policy, and really now to influence and be a voice for health system reform. Just move to our mission and values. So our mission, and we did review our mission over the last 2 years, and our mission really is now to promote health, well-being, and equity for all our population within the province through leadership in public health and promoting an effective public health system. And that's so important to us right now, especially as we see broad scale change across the province and really across the country and, the world as it relates to public health. And, I think that's something that we need to be mindful now as we move forward as an organization, is how do we embrace, this gift really, that, we've been through significant, focus on public health because of the pandemic for good reasons and not so good reasons. And now we have to really utilize, the time of this to kind of ensure that public health is seen and remains an important part of the health system, and ensure that public health capacity is increased through appropriate funding models and enabling public health to be front and center in those discussions around, revitalizing and revamping the health system. So our values are listed there, integrity and respect, equity and social justice, inclusivity and diversity. And just to give an example, we often have conversations around health equity. And in recent years, as we talk about the pandemic as an example, some of what we saw in terms of access to vaccines and access to information around, vaccine is certainly very important here. So these are some of the things that as an organization we're very concerned about as well. And also looking at populations that may not, may be underserved and may not have access to, services as they should. Our goals of our organization is to be an advocate, as I mentioned, and really to look at capacity, infrastructure, and leadership. And we've done a lot of work with our provincial health leadership in having those conversations and really trying to drive change and to ensure that we're at the table and a part of that conversation around public health change. Also to be a credible voice on priority public health matters and issues. And we've written a number of position papers, and we will have submitted a number of documents to particular bodies in order to ensure that those public health matters are heard and that appropriate information is informing decisions there. We also have strengthened and expanded our strategic partnerships So organizations like yours and other organizations where we have common goals and where through the power of the multiples, we can really affect major change. And then finally, to enhance our stakeholder communication. So we did also revise our strategic plan, and over the last, we're getting actually, this will be the final year of our strategic plan, and we'll be, as an organization, having further review around revitalizing our strategic plan, especially now, probably more than ever, as we move into what the next 3 years looks like for our association. But these are our major goals here. And just to speak about, the relationships and engagement with government departments, we have done a significant amount of advocacy there through letters to ministers, members of the House of Assembly, and also to key public health leaders to ensure that that our voice is heard and that the focus is on the things that we feel are important to the public health leadership and public health association. We have also focused on healthy public policy, and our position paper on what is public health and why it matters actually demonstrates that as well. So looking at, supporting and promoting ongoing work related to public health legislation. And, in this province, we are certainly very mindful and recognize that we have one of the best pieces of public health legislation in the country now. And we really want to ensure that we optimize that. And that, so we, as an association are looking to, hear the status of that legislation and reports that should be coming out of that and the elements within it around other strategies, including healthy active living, the sexual health strategy, and poverty reduction, really seeing those, health in all policies approach across government. We would certainly be supportive and would want to see that is continued and that public health has a very strong voice in that conversation. It is going to be incredibly important, certainly as we come out of this pandemic, to ensure that public health remains at the forefront. Public health in a lot of our regional health authorities, we're still operating from a business continuity or urgent emergent service approach, because for the last 2 years, public health have really had one priority, and that has been, the pandemic response and all of the elements that have gone along with that. But certainly one of the things that we've also been involved in has been advocating to government as well, and in particular to Health Accord Newfoundland and Labrador around, what would be the role of public health in a new reformed health system, and ensuring that, it's adequately funded and we have an appropriate skilled workforce, and again, that the role of public health and looking at population kind of health issues is supported. So when we talk about public health capacity, I think it's important for us to recognize this particular issue. And this came out of the Canadian Journal for Public Health in June of 2019. So you can see there it says public health's contribution to the health of the population is distinct and valuable because it is the only part of the healthcare system dedicated solely to protecting and promoting the health of the population and preventing illness and injury. And recognizing that in Canada, only 5.5% of our total health spending is on public health, which is, remarkable when we consider all of the work that public health has been through in the last couple of years, in particular, in terms of the pandemic response, indeed. So certainly there's a need to recognize, support, and strengthen the investment in public health to protect the health of the population, prevent ill health, and promote good health. And that's really what we're about as an organization, is ensuring that, public health capacity is protected and maintained, and that we do ensure that we see that happening. And, we do know that from an advocacy perspective that, everyone would endorse population health goals. And I mean, when we look at those broad goals really being, reducing disparities between groups and, focusing on prevention and having more prevention as opposed to intervention or treatment, and reducing, unhealthy behaviors, and ensuring that health is more holistic and inclusive, and in supporting healthy built environments. So I think, nobody would argue with that. But, again, in a health system where, funding is limited and where there is a significant focus on treatment in a province that has significant burden of health around chronic disease, et cetera, these goals sometimes end up being, I won't say lost, but somehow diverted. And they don't become in the front seat because, the immediate need for care and treatment sometimes, rises to the top. So it's as an association, we have to ensure that we create a similar sense of urgency around public health to make sure that we look at the future of the population of Newfoundland. So we have, through our work that we have submitted, a document to Health Accord Newfoundland and Labrador on the role of public health in a reimagined health system. And we also participated in a roundtable on public health with Health Accord NL, and in particular with the two committees that were engaged in discussion around public health. And they were the Social Determinants of Health Subcommittee and the Community Subcommittee. And you can see here some of the work that has been done throughout the last few years. And again, our focus is really on advocacy, education, and prevention programming. It's an active voice to promote public health, and it's guided by our principles of disease prevention, health promotion and protection, and healthy public policy. Our second goal is really to provide a credible voice on priority matters and issues. And we do this through our network of other partners and affiliations with other groups like yourselves, being at the table with like-minded individuals and organizations, and, developing position papers and developing, strategic positions around public health is so important as we move forward. But also surveying our membership and identifying opportunities for forums to educate and advocate for other public health issues, and learning from our membership as well and others on what is important to them. These are some of the position papers that we did complete over the last number of years, and some of those, of course, the college was a key partner in as well. And we would continue to look to have the college maintain a role and maintain a key partnership with us on that, as well as other professional bodies. So those are our position papers. And as we look at our strategic plan for our third goal is really around expanding and strengthening our strategic partnerships. And we have identified other areas of collaboration, including the Perinatal Mental Health Alliance of Newfoundland, and also the Canadian Mental Health Association, looking at population mental health promotion. We've also connected with housing and homelessness, and looking at some of those other, underserved populations. We're also connecting with First Light and the Indigenous populations to look at how we can more effectively support and work collaboratively to ensure that voice is heard as well. So really building a supportive coalition to lay a foundation for change and strengthening public health capacity is what we are trying to do through this particular goal. One is certainly a recent example of where we have been involved has been around food security. And, we have a key partnership with Food First NL, looking at our food, our Everybody Eats discussion paper and consultation guide. We sit at the table with Food First NL, and we have been a member of the Everybody Eats leadership team and the working groups on the cost of food, and we have maintained that collaboration. So those are important partnerships that we need to keep. And here you can just see some of the partnerships that we are involved in. And we are also looking at a proposed partnership with other public health associations in Atlantic Canada. And again, with, everyone is struggling with, membership and just the busyness of the time, that, there's an opportunity to strengthen our Atlantic partnership, hopefully, and to build on with common associations, common issues that happen across Atlantic Canada. And our final goal for our strategic plan is really to enhance our stakeholder communication. So this year we did also relaunch our website and our social media platforms. We have increased our social media activities, and we're also now looking at ways to engage and access our membership more. We've migrated to a Teams platform in order to support more virtual opportunity to meet. And we have increased our linkages to other public health organizations, such as the National Collaborating Centre for Public Health and the Public Health Agency of Canada. So really looking at where we can be involved in national agendas, but also bring it to the provincial level, looking at our partners, and how do we kind of share that good work that we're all doing. These are some of the education events that did happen over the last 2 years, and you can see quite a variety. And we certainly are looking to expand our showcase of providers. So if anyone is interested in and has something that of interest to the Public Health Association that you'd like to share with us, we'd love to have you come and join us for a meeting and share your insights and your knowledge with our membership. There's always room at the table, so we certainly look forward to that. And we probably will be reaching out to some of you. I did look at the names and the people that were on screen. So I know some of your names and I know some of your backgrounds, and we'd certainly be happy to have you would join us. And then finally, these are our contact information. So you can see that, our mail, email, our website, and social media. So that's really just a summary of where we are as a public health association, our strategic plan, where we're going. Hopefully that gives you some broad insight into the work that we're trying to do. It's certainly, I think, I can speak as a member at large for the association, but also in my role as executive member for population and public health with one of the RHAs, and having sat on the health accord as well in one of their committees. I mean, the time I think is really important, time for public health to really demonstrate, where we can be in terms of this health system and where we want to be, and a very vital role that public health plays in, kind of transitioning us from, a healthcare system that is really focused on urgent care and treatment, but also to look more at prevention and promotion and to move a lot more upstream than we have been in this province, to primordial prevention for sure, and to really work with our community agencies to look at some of the factors which do, support public health and support better health and well-being for individuals.